You know, in medicine, some of the most important discoveries happen completely by accident. Today on The Explainer, we're diving into one of the most common ones, the adrenal incidentaloma. We're going to break down what it means when a scan for one problem accidentally uncovers another, and more importantly, why it's usually not a reason to panic.
So let's just picture this for a second. You go in for a CT scan for something totally unrelated. Maybe you've had some annoying back pain. Then your doctor calls and says, well, we found something we weren't looking for, a little mass on your adrenal gland. Your heart just drops, right? But what happens next is actually a really clear, really structured process. So to make sense of all this, here's our roadmap. We're going to define what this accidental finding is, walk through the two simple but absolutely critical questions that every doctor asks, and then see how the answers create a really straightforward plan.
Okay, so first things first, what in the world is an adrenal incidentaloma? Let's just break down that name.
The biggest clue is right there in the name, incidentaloma. It's literally just a mass or a lump found on one of your adrenal glands. Those are the little glands sitting right on top of your kidneys, totally by accident during a scan for something else entirely.
Now, let's just pause here for a second, because this one number is probably the most important thing you'll see. The overwhelming majority, we're talking over 85% of these accidental finds, are completely harmless. They're benign, so not cancerous, and they're non-functioning, which means they aren't messing with your hormones. That is a huge, huge relief right from the start.
And as this chart shows, these things are really tied to age. You can see they're super rare in anyone under 20. But then, look at that jump for people over 70. It's almost 1 in 10. So for a lot of people, this might just be a normal part of the body's aging process.
So when a doctor finds one of these, what happens? Do they panic? Nope. Instead, they boil this entire complex situation down to two basic questions that guide every single next step.
And here they are. It's this simple. Number one, could this be cancer? And number two, is this little mass secretly pumping out extra hormones and messing with the body's chemistry? That's it. The answers to these two questions determine the whole game plan.
All right, let's dig into that first big question. To figure out if the mass is malignant, doctors basically become detectives, and their best clues come directly from that CT scan itself.
The first and maybe the most obvious clue is just plain old size. The general rule of thumb is this 4-centimeter cutoff. Anything smaller than that is very reassuring, super low risk for cancer. But as it gets bigger, the concern goes up, and that means we need to look a little closer. Okay, the next clue is a bit more technical, but it's incredibly useful. It's a measurement called Hounsfield units, or HU. The easiest way to think about it is like this. It's a way to measure the density of the mass. It tells the radiologist what the lump is actually made of.
So here's the magic number you're hoping for, less than 10 Hounsfield units. That is fantastic news. It means the mass is low density and lipid-rich. Basically, it's fatty. And that is the classic sign of a totally harmless, benign adenoma. If the number is above 10, it just means it's lipid poor, and it needs a bit more investigation.
So you can really think of it like a checklist for don't worry. Is the mass small? Is it low density? Does it look uniform and have nice smooth edges? If you can tick all those boxes, all signs are pointing towards it being completely benign. Okay, so let's say the scan looks great, we're feeling good about the cancer risk. Are we done? Not quite. We still have to answer that second critical question. Even if this thing looks harmless, is it causing any mischief by secretly pumping out too many hormones?
You have to remember, your adrenal glands are basically little hormone factories, and sometimes even these benign masses can go into overdrive. The most common hormone they overproduce is cortisol, which you might know as the body's main stress hormone. Too much of that can lead to a condition called Cushing syndrome, which causes things like high blood pressure, weight gain, and feeling tired all the time.
So this table pretty much lays out the standard screening playbook. Doctors will check for a few key culprits. First, that excess cortisol we just talked about. Second, they'll look for excess adrenaline, which comes from a rare tumor called a pheochromocytoma. And third, they'll check for aldosterone, a hormone that controls your salt levels and blood pressure. It's all very systematic, just to make sure nothing is out of whack.
All right, we've done all the detective work, we've asked our two big questions, so now it's time for the final step, putting all those clues together to map out a clear path forward.
I know, this flowchart looks a little intense, but trust me, it's actually really logical. It's just a visual map of the doctor's thought process.
You can see how it starts with size, then branches out based on those imaging features like Hounsfield units, and then finally it pulls in the results of the hormone tests. It's just a map that turns all that info into a clear decision.
And really, when you get right down to it, it all funnels into one of these two main pathways. If everything looks good, it's small, it looks benign, and it's hormonally quiet, the plan is just watchful waiting. But if it's large or looks suspicious, or it's causing hormonal chaos, then surgery is usually the best way to go.
So what about that observation path that most people end up on? What does that really mean? Well, it doesn't mean they just forget about it. It usually just means another scan in about 6 to 12 months, and maybe rechecking some of those hormone tests. The goal is simple, just to make sure nothing's changing, giving everyone peace of mind.
So let's wrap this all up. Adrenal incidentalomas are common, they're found by accident, and this is the big one, they are almost always benign. The whole point is that by using a systematic approach that focuses on two simple questions, is it cancer? Is it hormonal? Doctors can take a scary, uncertain moment and turn it into a clear, logical, and usually very reassuring plan.
And that really leaves us with a fascinating final thought, doesn't it? This whole process kicks off with a complete accident, a chance discovery. It's just a powerful reminder that sometimes in medicine, the biggest insights don't come from what we set out to find, but from what we stumble upon along the way.